Hello everyone. Today we will learn something about posture and analysis of posture. Posture describes as a position of the body or the arrangement of body parts relative to one another. What is postural development? Postural alignment starts its development in early period of life with development of spine and its curvature. You must have known about primary and secondary curvatures of the body. Initially at birth, the spine is in C-shape, that is a primary curvature. Later on, it develops the cervical and the lumbar curvatures. Those are secondary. Classification of posture: static, dynamic, correct posture, and faulty posture. Static posture is like when the body and its segments are aligned and maintained in certain position. Dynamic is when we are in motion or the segments are moving. Then a correct posture. Correct posture is the attitude assumed by the body parts to maintain stability and balance within minimum effort. And what's a faulty posture? It is any deviation to the ideal or good posture. You can see in the pictures. What are the causes of faulty posture? Defects, bad habits, pain, fatigue, bad psychological status. That is also very much responsible. Effects of faulty posture. As a result of poor posture, body functions are quite altered and lead to dysfunction and disease. Sedentary deformities and compensatory postural defects, pain, bad cosmetic appearance, etc. What's a postural control? It is somatosensory system, visual system and vestibular system. All are necessary for the postural control. Then comes analysis of posture. Here are few factors affecting analysis of posture. Then here is the spinal column. We have two primary curves, that is thoracic and sacrum, and two secondary curves, lumbar and cervical. Postural assessment. To assess the posture ideally, the subject stands upright. We have to observe the patient in anterior view, posterior view and lateral view. What are the parts to observe? Head alignment, curvature of the spine, shoulder and arms, pelvic inclination, hip, knee and ankle joints. First comes the posterior view. In the posterior view, you can see the plumb line bisects the head through the external occipital protuberance. Head is positioned squarely over the shoulders and so that the eye are in the same level. Then comes the trunk. In the trunk, the plumb line bisects the spinous process of the thoracic and lumbar vertebra. In pelvis and hip, it bisects the gluteal cleft and the PSIS. Here are other common falls which you can read in the slides. Knee. In knee, the plumb line bisects equidistant to the knees. Here the falls are genuvarum and valgum. Ankle foot. The line is equidistant from the malleoli. Then comes the anterior view. Here the plumb line bisects the head at the midline into two equal halves. Shoulder. A vertical line bisects the sternum and the xiphoid process. Here you can observe dropped or elevated shoulder, clavicle and joint asymmetry. In elbows, the common faults are cubitus valgus and varus. You can read about carrying angle. Just let me know in the comment section what is a carrying angle. Hip, common faults, lateral rotation, medial rotation. Then comes the knee, common faults. For the knee, common faults are patellar malposition, external tibial torsion and internal tibial torsion. Then for the ankle and foot, common faults are hallux valgus and hammer toes. In the picture you can clearly see them. Then comes the lateral view. Lateral view for both right and left. Here the plumb line falls through the earlobe to the acromion process. Common faults are head forward posture, flattened caudotic cervical curve and excessive lordosis. For shoulder, it falls to the acromion process. You can see retracted or protracted shoulders. In thoracic and lumbar vertebrae, it bisects the chest symmetrically in thoracic, and it falls midway between the abdomen and slightly anterior to the sacroiliac joint in the lumbar. You can see in the picture the normal spine, here is the kyphosis and the hyperlordosis. Then comes the pelvis and hip. Here the line falls anterior to the sacroiliac joint and posterior to the hip through the greater trochanter, creating an extension moment. You can see the falls like anterior pelvic tilt and posterior pelvic tilt. In the knee, it passes slightly anterior to the midline of the knee, creating an extension movement. You can find genu recurvatum, that is hyperextension of the knee, and a flexed knee. Ankle. Here the line slightly anteriorly to the lateral malleolus, aligned with tuberosity of the fifth metatarsal. Forward posture. So that's for today. Thank you. And you can see